Hello, my name is Bailey Zellers, and I'm going to be showing how to put on sterile gloves and maintaining a sterile field and also doing wound care. So first I would start off by doing hand hygiene, knock on the patient's door, introduce myself. Hello, my name is Bailey Zellers, and I'm the student nurse that's going to be providing your care today. I'm going to check and verify that you're the correct patient by your armband. Okay, everything's good. I will then explain the procedure to the patient. I'm gonna, put on sterile gloves, maintain a sterile field, and then I'm going to do your wound care on your leg. I would then make sure that the order is written that way before coming in by the doctor that this is what he has ordered for this patient. So then I would start by putting on my gloves. I'm going to show how to do the sterile glove. I have my sterile gloves here. I'm just going to open them up. Okay. So I'm going to start by touching only the cuff. I'm going to turn it around. I'm touching the cuff. I'm going to put my hand inside, which is the not sterile part. So I'm going to put those on that way. Then with my sterile glove, I'm going to go inside the cuff of these other gloves, like so. And then I'm going to put my hand in here. And so then I'm able to pull the glove up all the way by staying on the inside of the glove. So now I can go on the inside of this glove and pull it down. So now I have my sterile gloves on. I can touch the inside of this paper to dispose of the trash. My wound care tray is already open. That's where I got the gloves from. So then I'm going to set these extra gloves to the side. Here. I have the little drape. It's like a sterile drape. I'm going to open it up. Okay. Now, I don't want to reach across there because then it'll can't contaminate the sterile field. Have already removed this dressing that was on here before. I assessed it to see if there is any type of drainage, so forth. This sterile kit comes with a bag, disposable bag for biohazard waste, mostly for all of the old wound stuff. Like a moisture-proof bag. So have that open. You don't want to touch the outside because then you contaminate it. It's sterile. So I have my ABD pad. Then I have the gauze to clean it. I want to keep my stuff like an inch away from the border, just to assume that that's contaminated. I have my gauze wrap, like acrylics. Then I got tape. And I have sterile water, a little normal saline, to clean the wound. So I would start by getting this 4x4 gauze. I would get it wet. Get it wet, and then I would clean the wound that I took the bandage off. I clean it from the inside first, then dispose of the trash. Then I'd get this and clean the outside. Put that away. You want to keep your hands above elbow level. If I reach down, then it would be contaminated. I would then grab the ABD pad. I'm going to wrap it around this leg here. Then I'd have the tape. Make it sure it's secured. And what the wound care would be just whatever the doctor had ordered for this patient, depending on the wound, what stage it was in. Okay. So, then I could dispose of the rest of this tape. I didn't use this tape, so I'll just clean up my area here. put the lid on here, throw it away. I would then dispose of this, throw it away, and then take off my gloves. I'm going to wad it up in this hand and go under this glove and come out this way. And that concludes the video.